So whether ovulation is occurring or not, how are you going to find out? So there are three methods for it. One is the direct method. Through laparoscopy you go visualize empty follicle. The other one is conclusive. If the pregnancy has occurred, for sure ovulation must be taking place. And the third is indirect, where through several ways you are trying to reach up to the conclusion whether ovulation is there or not. So the first one is basal body temperature. Basal body temperature in females takes a biphasic pattern. So what happens is, at the time of ovulation there is a rise in body temperature by about 0.5 to 1 degree Fahrenheit, and then it sustains through the second half of the cycle, and then about 1 or 2 days prior to the menstruation the body temperature comes down again. So this graph can be plotted. So daily BBT recording has to be taken, and then you will find that there is an elevation in temperature and then there is a fall. This will not be seen in the patients who are anovulating. Second point, cervical mucus study. So the second is cervical mucus study. So cervical mucus is whenever it is under the influence of progesterone, then the pattern of the mucus changes. So on 22nd day of the cycle, mucus is drawn, a slide is prepared and observed. The interpretations which are in favor of ovulation are: the mucus is thick and opaque now, which was clear and watery earlier. Then now it has no furning pattern and the stretchability is also less now. So the amount it can be stretched up to length of 10 centimeters during estrogenic phase. उसको बोलते हैं spin Barkett phenomena. तो अब कहेंगे कि spin Barkett phenomena is lost, है ना? तो इस तरह से हम ovulation का पता लगाते हैं. And third है vaginal cytology. Vaginal cytology जो 3 तरह के cells होते हैं vagina में. एक parabasal cells होते हैं, second intermediate और third superficial cells. Okay, so under the influence of estrogen there is a predominance of superficial cells, and when ovulation occurs and progesterone also comes in effect, then the cytology shifts towards the left. It comes in the mid zone. So intermediate cells will be more in number. तो ये तीनों तरह के जो सेल्स हैं ना, ये कितने हैं, तो the vaginal cells, the shed vaginal cells, they are observed per 100 cells. What is the proportion of these 3 kinds of cells? Parabasal, intermediate and superficial per 100 cells per high power field. वो पता लगाते हैं, और वो cytology shifts towards the left side and comes in the mid zone when the body is under the influence of progesterone also. So this is about the cytology. Then the third thing is hormonal study. तो कौन से hormones से हम पता लगा सकते हैं कि ovulation हो रहा है कि नहीं? तो one is the progesterone. Progesterone कितना है? तो एक 8th डे पे प्रोजेस्टेरॉन का सीरम लेवल करवाते हैं और एक 22nd डे पे करवा लेते हैं, और उसमें डिफरेंस आएगा, है ना? तो डिफरेंस जब 8th डे पे कराएंगे तब तो प्रोजेस्टेरॉन बिल्कुल 0 या 1 नैनोग्राम पर ml के करीब होगा. 22nd डे पे 7 to 8 नैनोग्राम पर ml होगा. तो उससे हमें देयर इज अ राइज ना, तो ये चीज़ इंडिकेट करती है कि ओवुलेशन हुआ है. दूसरा, ल्यूटिनाइजिंग हार्मोन एंड सीरम एस्ट्राडायोल लेवल्स आर ऑल्सो यूज. So daily you have to record the LH levels, and there will be a peak in the levels of LH about 12 hours before ovulation. So whenever you observe a peak, after 12 hours ovulation will take place. Similarly, serum estradiol is also measured, and it takes a peak about 24 hours prior to LH peak. So ये point is endometrial biopsy. How are you going to find out? Through endometrial biopsy. So biopsy is performed usually in the premenstrual phase, and at that time the histopathology should show secretory phase in the endometrium, and if it is the secretory phase, it is a sign of ovulation. If the cycles were regular, only then you can ask her to come in premenstrual phase. But if the cycles are irregular, then you have to perform the test within 24 hours of the periods. And you have to take 2 samples which should be sent. One should be sent for histopathological examination and the other one for acid-fast bacillus. So this was about the endometrial biopsy. Now the last test which you can use for ovulation is ultrasonography. So transvaginal ultrasonography, follicular study is done right from 9th day of the cycle to 14th, 15th day. Gradually the size of the follicles, the dominant follicle will grow. It will grow up to a size of 18 to 20 mm before rupturing. It might rupture on 14th, 15th day, and after that period, when you perform a scan, you will find an empty follicle and some fluid in the POD, which will give you a sure indication of ovulation.